Duoneb is a sterile inhalation solution containing a combination of albuterol and ipratropium. Albuterol and ipratropium are bronchodilators that relax the muscles in the airways and increase airflow into the lungs. Duoneb inhalation solution is used to prevent bronchospasm in people with chronic obstructive pulmonary disease who are also using other medicines to control their condition. How to use? Use Duoneb exactly as prescribed by a doctor. Follow directions on the prescription label and trail medication guides or instruction sheets. Duoneb is usually used 4 times per day. Follow your doctor's dosing instructions very carefully. Don't use more than 6 inhalations in a 24-hour period. Overuse of Duoneb may increase the risk of death. It is critical that you use only the prescribed dose of this medicine. To use the solution with a nebulizer. Open the foil pouch and remove one vial. Empty the medicine into the chamber of the nebulizer. Attach the mouthpiece or face mask, then attach the drug chamber to the compressor. Sit upright in a comfortable position. Place the mouthpiece into your mouth or put on the face mask, covering your nose and mouth. Turn on the compressor. Breathe in slowly and evenly until no more mist is formed by the nebulizer and the drug chamber is empty. Clean the nebulizer after each use. Follow the cleaning directions that came with the nebulizer. Use the dose for chronic obstructive pulmonary disease. Inhalation solution. 1 3 ml vial 4 times a day via nebulization. Maximum dose up to 2 additional 3 ml doses per day if needed. Contraindications. You should not use Duoneb if you are allergic to albuterol, ipratropium or atropine. To make sure Duoneb is safe, tell doctor if you have overhead, heart disease, high blood pressure, coronary artery disease or heart rhythm disorder. A seizure disorder such as epilepsy, diabetes, overactive thyroid, glaucoma, liver or kidney disease, or enlarged prostate, problems with urination. Tell doctor if you are pregnant or breastfeeding. This medicine is not approved for use by anyone younger than 18 years old. Warnings. Seek medical attention if you think Duoneb inhalation solution is not working as well as usual. Overuse of Duoneb may increase the risk of death. It is critical that you use only the prescribed dose of this medicine. Before you use Duoneb, tell doctor if you have heart disease, high blood pressure, coronary artery disease, a heart rhythm disorder, seizures, diabetes, overactive thyroid, glaucoma, an enlarged prostate, urination problems, liver disease or kidney disease. If this medication gets in your eyes, rinse this watch and seek medical attention. If you're driving or has this activity, I tell now how Duoneb will affect you. Your vision or reactions could be impaired. Duoneb side effects. Get emergency medical help if you have signs of an allergic reaction to Duoneb, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have wheezing, choking, or other breathing problems after using this medicine. Chest pain, faster or pounding heartbeats, fluttering in your chest, tremors, nervousness, swelling of your ankles or feet, blurred vision, tunnel vision, eye pain, or seeing house around lights, painful or difficult urination, or low potassium, leg cramps, constipation, irregular heartbeats, fluttering in your chest, increased thirst or urination, numbness or tingling, muscle weakness or lymphedema. Common Duoneb side effects may include headache, trouble breathing, or cold symptoms such as stuffy nose, sneezing, cough, or sore throat.